They've been called skin tags, growth, bumps, age spots. Today, we're gonna talk about Dermatosis Papulosa Nigra. I have them myself. We're gonna talk about who gets them, why you get them, and how to best treat them. So continue watching if you wanna learn more. So Dermatosis Papulosa Nigra, or DPNs, we like to call it for short, is something I see all the time. You know, as a dermatologist, I do skin checks day in and day out, and this is something I see on a regular basis, multiple times throughout the day. It essentially is a benign growth, and it's a cousin, a variation of something else that is very common called seborrheic keratoses. And both of these things look literally identical under the microscope. I say eventually everybody is going to get a few of these, whether it's DPNs or seborrheic keratoses. DPNs tend to have a slightly different look. They are often much smaller. So if you look at mine, I have these like fine flesh to yellow-like bumps on my cheeks, but they are much smaller. They tend to occur on the face and have like a predilection for the neck as well. Both DPNs and seborrheic keratoses are what I like to call them age spots, because we don't tend to find them in babies or younger kids, but in our late adolescence, starting in our 20s and 30s, they do start to develop. And it is something that you can just thank your parents for, because literally I think over 95% of this is genetically determined, just like the number of moles that you are kind of destined to get. And one of the frustrating things is, even though they're age spots, we tend to think of them coming on in areas of sun exposure. These can have a predilection for sun exposed areas like the face, the arms, but they also can come in areas that can be very problematic or just annoying. For example, like under the breast and the armpits and around the neck, where they can often be itchy and can get caught on jewelry or necklaces. But if you look at my skin, or say even celebrities or well-known individuals, for example, like Morgan Freeman, he's got a lot on his cheeks. Even Barack Obama, you can find quite a few of them. And so this is definitely something that is very, very common. And honestly, like I said, it is something that you will eventually develop. It's just a matter of time. So neither DPNs or seborrheic keratoses are dangerous. They often can be mistaken for skin cancer. They often do, or at least it seems like they literally erupt over the span of overnight or a few weeks. And once you find one, it's like, bam, they all of a sudden explode. But definitely they're not dangerous. They don't morph or have the predilection of turning into skin cancer. But because of how fast they can come on, and because they also can come in a wide range of colors, from flesh color to white to tan to brown to even sometimes like this jet black color, I often will have patients come in making sure that they are not skin cancer, but they don't have the same predilection. They don't turn into skin cancer. And really, it's more just a kind of annoyance, and a lot of it is more purely cosmetic concern. Or say they can become slightly more raised, they can be itchy and just rub on clothing, get irritated, or catch on jewelry. One of the most common asked questions I get on social media is, can I prevent these, and what can I do to treat them? Unfortunately, the answer to number one is no, you can't prevent them from happening, because there are predominantly genetics and it's built into your genes. However, the good news is they're very much treatable. One of the most common ways I treat these benign growth, predominantly for seborrheic keratoses, is do something called cryotherapy. It's using cold to treat skin tags, seborrheic keratoses, and if you've ever been to a dermatologist for warts, we often will use this to treat warts. Cryotherapy essentially is liquid nitrogen that's negative 200 degrees, and essentially what we're doing is performing a controlled destruction of your skin. So literally, it's so cold that it's burning the top layer of your skin off. But in this situation, these keratoses or DPNs, they are very superficial growth on the top layer of the skin. So by destroying that top layer of the skin, you're essentially removing that benign growth. And it works really well. It does hurt. I've done it myself. It does hurt. The spots don't fall off right away, but usually what happens is the skin kind of gets red and crusty, and then within a few days, 2 weeks, it will fall off and leave a little bit of a pink mark behind. It doesn't cause any scarring. It's pretty quick to do, and it's very easy to do. Now, reason why I don't like this treatment for darker skin individuals, and I often don't use this unless the patient wants me to, is because your melanocytes, the cells that create skin color, are very sensitive to heat and to cold. Melanocytes can become damaged at -5 degrees Fahrenheit, and liquid nitrogen is like -200. So often in my darker skin individual patients who are wanting to have their DPNs or even keratosis treated, predominantly it is for cosmetic reasons. So here we want to be mindful and not create additional damage to the skin or unsightly marks to the skin. So one of my favorite ways in treating DPNs in my skin and color patients is using something called electrodesiccation, which essentially is another tool that we as dermatologists have in our toolbox. It's a machine that basically generates electricity that is then turned into heat, and it's often used with a fine tip needle. We use it in surgery a lot to stop bleeding, but here you can kind of change the setting of the machine. When it's on a lower setting, especially with that fine needle tip, you're able to essentially kind of char and burn those superficial growth, those DPNs, and literally they kind of just literally melt them off the skin once you kind of desiccate them off. This is great because number one, on the lower setting, it's less likely to cause damage to the skin and to the surrounding skin, so to minimize any potential post-treatment hyperpigmentation. And two, with that needle tip, you're really able to get right into precisely treat those discrete spots. Now, it is uncomfortable, so often what we do is we apply numbing medication beforehand to minimize that discomfort. Other options could be, if they're big enough, you can always have them snipped, and also certain types of resurfacing lasers work the same way. But again, for my skin and color patients, resurfacing laser may not always be the best choice because it can cause potential disruption in their skin color post-procedure. With these treatments, whether it's cryotherapy or electrodesiccation, aside from laser, there's really minimal downtime. We just talk about briefly how to take care of these spots because the skin will get crusty afterwards, petrolatum as they're healing, and then obviously sunscreen is really, really important to minimize any potential discoloration of the skin. But usually you're able to shower, wash your face, even cover these with makeup if you'd like. One last thing to consider if you have a lot of these rough, larger spots, keratoses on the arms and legs, and just don't like the texture, is try an exfoliating body lotion, like ones that contain glycolic or lactic acid. It's not going to take these spots away, but it can help with the roughness and potentially their appearance. And that is usually what I recommend to my patients when they have a lot of these growth all over and just really don't like the feel and the texture of these. So a body lotion with AHA can be very helpful, but again, it's something that you have to use on a regular basis. So that was my quick and dirty on DPNs and keratoses and how I treat them as a dermatologist in office for my patients depending on their skin color. If you had any of these treatments done yourself, comment below and let me know if they worked well for you. I would love it if you could give this video a thumbs up and subscribe to my YouTube channel. You can find more of me on my social media, and I will see you guys next time. Bye!